Greetings from around the world to colleagues. I'm honored to be here and represent AORN as a partner with Compass in growing excellence in perioperative nursing and patient care. We're excited to support perioperative nurses as they advance their careers around the world. So what is excellence in perioperative care? I have a very simple definition right here, and we'll talk about it a little bit. It's really simple to describe. It's not so simple to achieve. The right resources for the right surgical care at the right time with individuals, team, and physical resources so that there are optimal outcomes for the patients, which we all want. And the pathway to that can be very complex. Why is excellence important? Well, it depends on your view. So I put a couple of views here. The administrator, surgical care counts for at least 60% or more of the financial bottom line of a hospital and a significant amount of the reputation as well. Having high functioning teams brings safety and efficiencies to a high cost and high revenue area. The surgeon, well, then we know they love doing lots of cases, and having a well-educated and competent surgical team enables them to really focus on the surgery itself and enable them to have safety and efficiencies in their own care. Of course, the patient expects us. They expect great care every single time, high quality, timely care, and safe care to improve their health. And we all want happy patients at the end of the day. So what does the perioperative nurse want for excellence? Well, they want to have great care, deliver great care, and be proud of that care. They also want to have the resources and the education they need to grow as professionals, to be able to continue to give great care. They want to work with safe levels of staffing and have a team around them that supports great nursing care and that helps them grow as well. And this is what helps keep great nurses as well as attract great nurses as well. I'm a career-long perioperative nurse myself, and there's a lot of things about perioperative nursing that really haven't changed. It is a high-tech area with lots of technology in it, and it continues to evolve. It is not a sport that you can't continue to keep working on all the time. It's high risk. So evidence-based practice, or EBP, helps drive prevention of that risk and safety within that risk of surgical care. There's always pressure to get faster, manage the time, not have delays. There's team dynamics. As important as the clinical skills are, the communication skills within the context of a very dynamic team are important for enabling great care. It's very specialized, which is why we're here today. You can't just have the emergency room or the ICU nurse pop over and cover. It's very specialized care with a lot of knowledge that predicates the safe and excellence care that we're talking about. You also just can't go home when you're tired. You've got to finish a case, can't pause and just come back tomorrow. And so therefore, there's a lot of on-call and after-hours needs that are part of a workload and part of the real challenge of keeping great folks. One of my favorite lines that keeps me going is that the patient really gives us their sacred trust that we as nurses are their advocate to speak for them when they're in our care and they can't use their own voices. Some of the things that have changed about perioperative nursing is the pandemic certainly was a huge disruptor of care delivery and the impact on healthcare resources. There's staffing shortages globally. I know I've heard about from the Compass group, the shortages that are going on in your part of the world. They certainly are going on here. Huge disruptor for us to drive that trend. Makes it harder to recruit and retain good staff because there's many options for them to go to. There are some estimates that 20% of nurses are going to be retiring within the next 5 years, which is a different element we have to look at in terms of providing great perioperative care. The post-pandemic surgical volumes generally are growing. Some people postpone their care during the pandemic and they're back and they're wanting it. So the need for great perioperative nurses is definitely there. And we do have growing evidence that demonstrates standardized, evidence-based education does improve patient outcomes and does decrease the cost of care. So important. So a little bit about AORN, if you're not familiar with it. The Association of Perioperative Nurses was founded in 1949 to provide a national community for operating room nurses who wanted to share best practices in the care that they delivered to patients. So today, we work with not only perioperative nurses, but healthcare organizations and industry partners to support safe surgery. Our vision, which I love, is that we will provide indispensable evidence-based resources to establish the standards of excellence, which is what we're here to talk about today, for each phase of perioperative care for optimal outcomes for each patient every time. We are the largest perioperative specialty association and are really proud of our reputation for supporting excellence in surgical care. This is our position statement supporting the perioperative registered nurse circulator for every patient, which you might be familiar with, but I think it really speaks to the impact of the perioperative nurse on patient outcomes. The clinical knowledge, the judgment, the clinical reasoning skills possessed by the perioperative nurse and how they impact patient care, and how not only improve patient outcomes, but with improved staffing, enhanced work environment, and better educated nurses, also have an impact on providing that great culture, that great environment from evidence-based knowledge. We know that quality education does save lives. Here's a few comments of how this pertains to perioperative nursing. Root causes from the National Institute of Health show that medical errors often come from deficiencies in education and training. Staff turnover is hugely costly to all departments and is up right now over here in the States, and sounds like it may be up for you. It's disruptive, and often career advancement and continuing education are cited as positive influences on keeping great employees. Professional practice is based on highest standards of evidence and lifelong learning, and we know that continuing to bring that brings the highest standards of patient care to a nurse's role and is very important to their success. AORN worked with Compass to develop a pathway for building surgical excellence and a standardized process for perioperative education. So I just wanted to share this right now for the key components and share a couple of things about these elements because it's why we're here today. We have a position statement about the importance of RN residency programs in perioperative nursing because we really feel that strongly that they help decrease the theory and practice gap and increase confidence, knowledge, and competence. They increase professional interdisciplinary communication, and they increase RN retention rates. We feel this is a strong platform for all of the other elements of a great perioperative career pathway. And as in some of the other elements that are challenges, a strong evidence-based nurse residency program can lead to increased job satisfaction, critical thinking skills, and the decreased turnover rates, which does provide cost savings to healthcare organizations. They also lead to improved practice, improved competence, and time management, and communication and collaboration skills. All these other elements of excellence in perioperative care that we've just talked about. It's a foundational element to the rest of the career pathway. And we feel strongly that a standardized programs not only covers the appropriate subjects, but at the right level of awareness as a novice. It helps reduce staff and educator training time and bring the highest standards of evidence to the knowledge and skills needed for competent practice. So once there's a standardized platform of a residency program to be the first building block There's other building blocks of Periop 202 with specialty procedures such as orthopedic, cardiac, gastrointestinal procedures, pediatrics. We also know that quality improvement is an important part of ongoing roles of perioperative nurses, and the QI course teaches ongoing care improvement processes. And the reason we're here today is for the CNOR, or the Certified Nurses in the Operating Room, and the importance of a strong certification element in a career pathway. So why is certification important? Well, I took a quote from the Future of Nursing report in 2010, where it talked about the ultimate goal of licensure, accreditation, certification, and education is to promote patient safety and public protection. That really spoke to the outward-facing part of certification, that it helps the public know the quality and amount of education that a nurse has to provide that competent and safe practice. Our position statement that we have that it takes us a couple of steps further is that obtaining nursing specialty certification is a key step to assuring patients and the public that they're receiving the highest quality perioperative nursing care. It's also a mark of excellence on the part of the nurse, and it's an effective means for nurses to demonstrate proficiency and quality in nursing practice. It also, for the leaders that are listening, helps create a culture that fosters commitment to lifelong learning, peer support, and mastery of standards and evidence-based practices, which ultimately result in enhanced workplace satisfaction, confidence, and safer patient care, a great environment for keeping great nurses. So this partnership that AORN and the Compass Health Consultancy are growing is really quite exciting, and we're very much excited about helping provide resources to have a great career path for high quality education for highly effective, excellent perioperative nurses. Thank you so much for including me today. I know that Dr. Colleen Becker will share more about the Prep for CNOR course, and Don Whiteside will be sharing more about the testing and certification process itself. Thank you all that are here today for investing in perioperative nursing excellence today by spending your time here today. Thank you.